9. The nurse cares for an elderly client admitted from an extended care facility. The client is confused and the family reports a 3-pound weight loss over the last week. What is the most important action for the nurse to take? So, step number 1, tell me in the participation chat, what is the topic? Okay, good. You picked on there's confusion. They also mentioned the fact that there's a 3-pound weight loss over 1 week. That's significant. So what's the priority? Now this is an example where when they give us more than one topic in the STEM, we've got confusion and we've got the 3-pound weight loss. If we're not exactly sure where they're going with it, what do? We look at the answers Erin says. She's exactly right. So let's do that. It says here, ask the family to describe the client's diet for the last 24 hours. Number 2 says weigh the client. Number 3 says offer the client a nutritional supplement between the meals. And number 4, obtain a serum albumin level. Well, after we just read those answer choices, I don't think this is about confusion. I think that this is focusing more on the weight loss or the nutrition status. Would you agree? Yeah. So Tori says nutrition is the topic. She's right on the mark. So what is most important? We're going to be looking at priority. Let's do step 2 of the decision tree. Ask the family to describe the client's diet for the last 24 hours is an assessment. Number 2, weighing the client is an assessment. We're gathering data. Number 3, offering the client a nutritional supplement between the meals is an implementation. And number 4, obtain a serum albumin level. We're gathering data, so that's an assessment. So we've got a mix. Anytime there's a mix, we go back up to the STEM and reread it to determine if there's any assessment information. And we have some. They've lost 3 pounds in 1 week. Do we need to further assess this and figure out what's going on with their nutrition status? Yes, you all agree. Fabulous. So we're going to eliminate number 3. Let's look at 1, 2, and 4 now. Would you call these physical, psychosocial, or a mix? Physical, perfect. Now, do we see any ABC answer choice here? We do not. So let's think about the outcome from each of these. Ask the family to describe the client's diet for the last 24 hours. So you'll note there is a time frame in this answer choice. Do we want to know their food intake for just 24 hours? Nope. We need to know more, all right? That's too narrow of a time frame. So the time frame makes answer choice number 1 incorrect. Would we want to weigh the client? Well, keep in mind, a weight, there are other things that can affect it, like their fluid volume status. Doesn't give us the best indication necessarily of their nutrition status. Obtaining a serum albumin level is the correct answer. That will give us a good indication of their nutrition status for at least covering the last about 2 weeks. All right? So number 4 is the correct answer for question number 9.